In a small primary care practice in Carson, California, Dr. Emil Padre and his staff of 3 serve 1,500 patients, including Melchor Lagunzad, who, like the majority of patients here, battles diabetes.
It is really a surprise because I didn't know that I have diabetes, and I was at the age of 55 then.
I've known Mr. Melchor Lagunzad for about, I would say, 15 to 20 years, and he has been a good patient. However, I guess just like any other patient, sometimes they fall off the cracks in terms of his diabetes management.
Too many diabetic patients were falling through the cracks, which caught the attention of HealthCare Partners, Dr. Padre's IPA. While the practice could only provide medication, HealthCare Partners was equipped to offer so much more.
HealthCare Partners Health Enhancement Program has existed for years, and it provides a diabetes management class. And so what we learned very quickly is that patients weren't attending. I had to dive a little bit deeper to understand the why.
It's offered at one of our sites, and training them on the causes of diabetes, how it can be managed through diet and exercise and lifestyle changes. And we even offered to Uber them there if necessary.
A robust resource, underutilized in part because attendance required a doctor's referral.
I thought, why would we have our offices submit a referral? They're already inundated with stuff. And so instead of having the doctors submit a referral, we know these patients. We now, HealthCare Partners, directly contact these patients on behalf of their doctors, schedule them to attend a diabetes class, to do consultations over the phone with a dietitian, and also speak to a diabetic specialist.
And HealthCare Partners worked with Padre's staff to create better ways to follow up with patients. It's a collaboration making a difference.
We've improved the process to the point where now everybody in Region 3 who has uncontrolled A1C is going to be contacted by the Health Enhancement Group to take this class. So nobody is going to not know about it.
I feel a lot knowledgeable now about diabetes.
Melchor embraced the class. He modified his diet, started exercising, and monitoring his blood sugar. He says it's been life-changing because it's been life-giving.
Last year, his hemoglobin A1C was 10.2. His hemoglobin A1C is now 8. And he's very, very happy about that.
A1C going from 10 to 8 is more than a number, right? That's a life.
It really takes a village. You know, it's not only the doctor, but it's the MAs, it's the front office. It's really kind of a whole network of people that are involved in the care of these patients. And so we try to identify where the obstacles are, where the gaps in learning are, and facilitate creating a smooth workflow for them.
And as HealthCare Partners supports its practices, they do so with the help of the Practice Transformation Initiative, a program supporting thousands of similar small practices all over California.
Change is good, but it's difficult. Practice Transformation Initiative, what it provided for me were tools and methods to help practices move through improvements. It's more of what matters to you, not what's the matter with you, but what matters to you. What matters to the independent practitioners, the office managers, the MAs, is what matters to me and what matters to HealthCare Partners. Keeping the patient at the center of that, that's where it counts.
Janet, I need an appointment. It's sad, but you know, my brother died of diabetes, my 2 sisters died of diabetes, you know, because it runs in the family. I am very hopeful about, you know, living longer because, you know, of Dr. Padre's instruction, the medication, and of course, the diabetic class management helps me a lot.
If we engage patients and we're intentional about engaging them, patient will be inspired. If we learn those things and make a difference on how we approach them, we'll see more Mr. Melchors.